Hey guys, Don here. Welcome to the $1,000,000 Minute. I'm going to go over kind of the things that actually worked in the office to get us to the $1,000,000 mark and beyond. So I'm going to put together both Monday and Tuesday because Monday was a full day, Tuesday was a half day, and now we're going to be kind of off for the holiday for the rest of the week. So the Monday was 25 patients. So usually I do about 22. I think they added a few extras. Because of the holiday, just people needing to get in. We have 4 doctors in the office, 2 are off, and so we'll just have 1 doctor in each office, so it adds a little bit. First patient was EPAT number 3 for bilateral Achilles pain. So this patient, bilateral Achilles, EPAT number 3, had been seen by another doctor before. Usually the last session I bill a level 3 office visit just because I go over what would be the kind of the plan for the future. Okay. Another patient came in. This was an MRI review. He ended up having a plantar plate repair or plantar plate injury, and on the MRI he is also dealing with allergic reaction to Lamisil. So he had been using a topical steroid cream. And then for this patient, because it's a plantar plate repair, I am referring this to one of my other colleagues here. I do the Arthrex, kind of the kind of plantar plate repair. I've done that. I just don't do a lot of it, and I'm not sure if they didn't really want to wait 6 months to see me, so I'm referring this to one of the other docs here, one of the younger doctors. That's just the way I choose to do it. Maybe you guys would want to do these. But he's already tried 3 sessions of shockwave, didn't really respond to it. He still continues to have pain, so I think surgery is going to be the best option. The challenge with him is he works in a garage, kind of repairing cars, and as a mechanic, and so it's a hard time to be off his foot for 6 weeks. Another patient that came in, he had been on Lamisil. He saw some clearing up of the nails, all except the great toenail. I put him on fluconazole, didn't really see much improvement from that. And so he still had this. Now he is a doctor, he's a primary care, but now he's working in construction. Kind of interesting. His wife is a doctor, and he just kind of builds houses now. And I'm always curious about that when people switch careers. But for his toenail, he had just the medial side of the hallux that was really thickened. And so what I did is I did kind of I numbed it up, did a partial nail avulsion, and then I put him on another round of the terbinafine because that worked the first time. And I'm going to see him back as needed if it grows back or if there's any abnormality after that. I would have thought that it would have cleared up with the terbinafine, but it didn't, and it had the kind of that almost like onycholytic line of yellow discoloration. So I just cut that portion out. Another patient came in. This was a 22-year-old female, young female with bilateral bunions, kind of big bunions. And so I think she's going to be better with a bilateral Lapidus. And so once again, I sent it to one of the other doctors in our practice to kind of do more of that. Another patient came in. This is a 64-year-old female, came in for a Porokeratoma follow-up. So what I do with Porokeratomas is I tend to take out the core, and then I do lesion destruction code for it, so kind of like as if it's a wart with silinocaine. So we have these little pads with a circle and an aperture patch, and then I put a Band-Aid, and they leave it on for like 24 hours. Then I see them back in three weeks, and I usually do it again. So that's typically what I do. So I do Porokeratoma, like office visit, level 3, Porokeratoma lesion destruction, see them in 3 weeks, do it one more time, and that's it. Then I don't follow up with them. If it continues to come back, then I'll make an orthotic for them. But this is the patient with the follow-up, so it's just the lesion destruction, no office visit, and I'll see them back as needed. Other patient was this. This is the gentleman. He had 6 sessions of EPAT for the 5th Met, and he had an amnio after the 2nd one. He is feeling like 100% better. Last visit, EPAT, I talk about what's next. I do a level 3 visit, and I'm going to see him in 3 months. Usually I do 6 weeks, but he's doing so good. I'm going to see him in 3 months. Because his main thing is he wants to get back to roller skating. So I said, well, you might need to get a little bit wider of a roller skate because he does have that Taylor's bunion that I think was kind of the whole area that was causing him pain to begin with. Another patient came back for the Lamisil follow-up. So I always do the nail sample first, see them back in 3 weeks, go over the sample, went over my whole discussion, and so this patient's going to get Lamisil, they get the LFTs, and then they get my package, which includes shoe sterilizer. They use that once a month, shoe spray once a week, and then they're using the biotin once a day. So that's kind of how I do it, and then they're going to be back in 3 months. Another patient came back, new patient came back. This was a patient that had kind of a soft tissue mass when she stood. It could be seen between the third and the fourth intermetatarsal regions, like almost like a baby sticking its head out. I thought it was a really big neuroma. When I did ultrasound, so I get x-rays first, didn't really show much. Ultrasound showed a neuroma with like soft tissue swelling around it. I was thinking it could have been like a combination neuroma / ganglion. So I did two procedures. One was the neuroma injection with cortisone, and the other one was the aspiration of the cyst. I did get some kind of ganglionish type of fluid, not as viscous as I thought it would be, and I'm going to see her back in 3 weeks to see how that one is. Another patient came in. This was a patient that had plantar fasciitis before, got x-rays, got ultrasound to show thickness on that side, and then started out with EPAT number 1 that same day, and he'll do number 2 and number 3. Now, he had it in the past and did well, and that's why he wanted it again. So I'm at the point where I've been doing quite a bit of shockwave, and they're coming back wanting it again because they know it's worked before. Other patient came in, level 3 office visit just for an IND for an ingrown toenail. Other patient came in for a matrix follow-up. Those are usually level 2 or maybe level 3 if I talk about something else, but usually level 2 matrix follow-up. Those are quick follow-ups. Another patient came in, a new patient for a neuroma, and they had pain on the bottom of the foot. And I got an x-ray, and then I did an ultrasound to look at the neuroma. And I did put this patient in a walking boot because they had so much pain, and I'm going to see them back in three weeks. Like they've just been limping around for a long, long time, hoping just to calm down all the inflammation in that area. Another patient came in for status post EPAT, and they're much, much better. Level 3 office visit, no follow-up for that one. So that was this patient is a 6-week follow-up after doing shockwave for the heel. Another patient came in for cantharidin on the 5th met base region, and they're doing better, but I think they're going to need another treatment, so I'm going to see them back in 3 weeks. I usually see my cantharidins in 3 weeks. Another patient came back for wart removal. This was a college student kind of in town. I did the wart removal for them, and they're going to not come back because they're going back to school. So a level 3 office visit with a wart removal. No follow-up. That was the morning, and then the afternoon was a Lamisil. So kind of a Lamisil, like a nail sample follow-up. So Lamisil, they're going to get level 4 visit because of the medication management, and they're going to get my kit, which I talked about before, and then a 3-month follow-up. Another patient came in for bilateral ingrown toenails. Not really inflamed or infected, but just kind of ingrown. And for this patient, I did bilateral Onyfix. I don't do a ton of Onyfix, but in this case, it was a good option for this patient. And the patient really didn't want the IND or the partial nail avulsion. Another patient came in. This patient, she is EPAT number 6 on the second met head. After the second visit, had amnio as well, and she is doing much better, kind of no pain, really, really pleased. I'm going to see her back in 3 months to see how she's doing. So very happy with her. She was like a second opinion coming in from Boston because she's had so many treatments in the past. Another patient came in. This is kind of a frustrating patient. I know we all have these. She's like here for orthotic adjustment number 2, and I feel like my life is being drained away from me. But I just listen to her and be patient, and then I modified her orthotic. She's like on orthotic pair number 3. Thankfully, I have a good company that, after the 3rd or 4th adjustment, they'll start to call me. but usually for the first 3, they're okay. So this patient's doing okay. I'm not sure if it's the orthotic or her. Next patient came in was a new patient. This patient had pain to the 4th met base cuboid region, and that's where her pain was. I did x-ray, look at it. I really saw it better on ultrasound, and I did an injection right in that area. And she also had some pain. She wanted to know about toe spacers and other things like that. I ended up doing a cortisone to the 4th met cuboid and also between the 4th and the 5th metatarsal, intermetatarsal space. I just put everything all around there to see if it's going to make it feel better. She felt better, so that means hopefully it's in the right spot. And then another patient came in with 5th met head pain, x-ray for her. And she had, I think it was just tight shoes, so I recommended Lems, so she purchased some Lem shoes. We sell Lems in our office. It's kind of more of an anatomic shoe. Next patient was a number 2 EPAT for peroneal tendon. She's starting to feel better. Next patient was a fracture follow-up, level 3 office visit. This one, the reason it was a level 3 with an X-ray is because it was a follow-up. And actually, no, there's no office visit, just X-rays. And she's doing much better. This is the little 12-year-old girl. Next was a matrix, bilateral, both edges. And this patient came in. She was, once again, a student in California, wanted to do the matrixectomy. She's going to follow up somewhere else because she's going to be gone here, so I can't follow up with her. Another patient came in for EPAT number 3 to the heel. Office visit because it's the last EPAT, and I give them a little EPAT handout. If you want that handout, just let me know. I can show you what I give them. But I give them something that talks about like what we're going to do next. So he'll come in 2 months. And the other one was a matrix follow-up. And then quickly today, kind of what this was kind of a crazy day as well. 14 patients just in the morning. Laser scar. This is a patient that had a barracuda bite her foot, and she had a really bad scar. And we did 3 sessions of laser. It really helped the scar, and along with some like Mederma and like scar guard tape type of stuff that she put around her foot. Another patient for Porokeratoma, like I typically do. I do lesion destruction, see them in 3 weeks. Another patient came in for an ulcer debridement to the tip of the toe. Put them on Augmentin because it's the holidays and I don't want any phone calls. Another patient came in, 52-year-old female, that came in for a plantar heel pain. They wanted correctos, so they got correctos, Lem shoes, and ultrasound to show one side versus the other, and they're going to get set up for 3 sessions of shockwave for the plantar heel pain. Another patient, Porokeratoma, lesion destruction, see back in 3 weeks. Another patient came in. She had been treated before for the Achilles tendon, hadn't come back in a couple of months, continues to have pain, did ultrasound, showed the thickness on the area of the Achilles, also the effusion that's on the area, where there was no bursa. Because it's kind of a chronic issue, and she's in so much pain, we did EPAT. So I have radial shockwave in this office, and then they also gave me I don't know if they gave us, but one of my partners is doing like a research study, so we have soft wave. So I did radial and soft wave on it, and I'm going to do 6 sessions for her, and she got a night splint as well today, so a level 3 office visit along with that. Another patient came in for this scar for the 5th toe, hammer toe that we did a while ago with a kind of a painful scar laser treatment number 2. I do, that's lesion destruction. That's what you can use for the scar. And I don't do a ton of those, but they kind of fall on the same day. So if I'm repeating myself, it's because they kind of come back weekly for 4 weeks. Another patient came back with an ulcer. She had one between the 4th and 5th toes, all the way really deep due to the soft corn that ulcerated, kind of really deep. PC put her on an antibiotic. I had her do betadine to dry it, and then lamb's wool to space it, and then nothing tight. I think it came from tight socks in the wintertime that she's been wearing. I'll see her in 2 weeks because of the ulcer. Another patient came in for bilateral first MPJ injections due to painful bunions. This gentleman's young, but he doesn't want surgery. He needs bilateral Lapidus, but he doesn't have time to do it. Another patient came in for an IND, ingrown toenail. This is a doctor friend of mine. He's a interventional radiologist, and he sent his daughter over, so we kind of fit them in. And the last one was an orthotic patient that came in that wanted new orthotics. So he has an insurance plan. I think the only one is Aetna here in Massachusetts that actually covers him, and he wanted his new orthotics before the end of the year. So anyway, that was the day. Once again, I hope you guys have a good holiday time if you're listening to this right before the holiday. Hope this is beneficial for you. Let me know if you want any of the resources that I'm talking about or anything isn't clear. You can shoot me an email, don@podiatrypracticemastery.com. If you enjoy these too, please just let me know. Like, shoot me an email just so I know like you're listening to these, you like these, or maybe just give a thumbs up wherever you're listening to this, if it's YouTube or if it's on Spotify or iTunes, just so I know that you guys like it. Give me a review, that would help. And tell your friends about it. Okay, thanks.